Hello and welcome. It's Friday, October 2nd, and this is Conversations, a production of the Oakville Chamber of Commerce. My name is Tim Caddigan, and I'm pleased to be your host for this weekly series. Conversations is a current event show where we engage business, community, and political leaders and get their perspective on what's going on in our community, across the country, and around the globe. And today we are joined not on Zoom, but in studio by our guest, Mark Majewski. Mark has had a career path of being an engineer to executive in various technologies. He's grown a multinational semiconductor company in Canada from sales of $20 million to $200 million per year. He's been the vice president of 2 technology startups, the lead for transformative technologies at Ontario Centres of Excellence, the OCE, and the CEO of Intelliflex, an alliance of 130 innovative companies. And now he's currently the senior vice president of Innovex. Mark is a catalyst for change, commercialization, and a passionate innovator that enjoys building successful creative teams, collaborative ecosystems, and designing strategic plans. He brings extensive business and finance experience with highly developed analytical skills and an inventive conceptual thinker. He's known for engaging effectively across complex organizational structures, creating and mobilizing multiple collaborators to integrate technical concepts into commercial products, and developing innovative approaches to policies, strategies, and business challenges. Mark is also no stranger to the Chamber of Commerce Network, and I'm so pleased to have him join me here in studio for today's program. Mark, you're the first in-person guest, and I couldn't be happier to have you here.
Great, thank you. Thanks, Tim.
So we have about 3 hours of topics and 30 minutes to cover it.
Perfect.
I want to jump in first. You and I had a chat earlier this week and a chat just before this show around what changes maybe we've seen due to the pandemic that will stick. Can you talk a bit about that?
So the angle that I'm coming with today is from really the data analytics part of the equation. But you know, there are so many companies right now that aren't digital, that don't have a digital strategy, and this is something that I'm seeing. And our business at Innovex and all kinds of businesses are exploding because people need to be digitally resilient. The pandemic was one incident, but there'll be other ones coming. And we have to start acting like a community and sharing data and leveraging data because the world is different now. You know, those companies that are standing still and not doing anything right now and expecting the world to come back to where it was, well, that's not going to be true because everything has changed. People are working from home. They're not commuting. Restaurants have changed. The way we buy things have changed. So everything has changed. So if companies aren't innovating, and I replace that word innovating with sustainability a lot because innovation seems to scare people. But if companies aren't becoming sustainable, they will fail. So it's really important to now take everything that's changing, expect it to change again, but to keep moving.
Right. We're going to spend a lot of time, I think, on the notion of data and just all the applications that you and I talked about earlier. But I do want to also get into a little bit around 5G. Before this, you said you could explain it to me as if I was my grandmother, and I think that's probably a good place for us to start with this conversation.
So 5G is the next level of data communication. Today we're at 4G, so it's just the next protocol for all our mobile phones or connections. But it is not an evolution, it is a revolution. So the pipeline of data in 5G is 1,000 times larger than the pipeline in 4G. So if you think of the 401, instead of having one lane, it's 1,000 lanes. And not only that, but with 5G, you can layer. So you can put another layer on top of those 1,000 lanes, and then another layer on top, and all of it is software driven. No longer do you need hardware to go up the poles and do things. And the last, or 2 more important things, is one, the delay. So today when you Google and you hit it and the little icon spins, well, the delay in 5G, the maximum allowed is 1 millisecond. If I poke you with a stick, you react in 14. So this is so fast, it is amazing. And this is what unlocks things like autonomous driving, because you can send the full video signal up, you can make decisions and send it down even before a human reacts. So this is a really important technology that moves the world forward. And many economists have said that 5G will unlock $11 trillion of new revenues, new businesses, and that's almost the size of the internet. So this is a big thing that's coming now.
So this is going to change really what we think of the internet.
It will add the next layer to the internet. It will be the next new mobility, video, all of this will be live, instantaneous, and we'll see apps we've never seen before. We'll see applications we've never seen before, and this makes data even more important.
So the 5G, it's, when you talk about that, the maximum allowable delay and things like that. So 5G is there, it's ready. It now has to be deployed.
Correct.
And so where are we in that in Canada and around Oakville, for instance?
So there are 60 cities that were just announced to have 5G in Canada. So Rogers, Bell, Cogeco, other people are starting to put up their antennas. Oakville, unfortunately, is not on that list of those 60 cities. So this is something we should be striving for, because this is what brings new businesses. This is what amplifies our businesses. So not being in that 5G portfolio is a problem. And for even if we don't want to wait for our politicians, if we look at a lot of private companies, they're putting up 5G because it gives them a private network. So if you could picture a campus, if you have one 5G antenna with line of sight of the whole campus, you can connect to over 100,000 nodes with one antenna. And you can have that gets rid of all the wires, all the routers, all the Wi-Fi, all of that disappears with one antenna. So this is a massive change to our infrastructure and how businesses, send out their internet signals and connect to their community. This is a large change.
Sounds like it. You touched on data at the start, and I know you had, I think you and I had a half-hour call booked and we spoke for 40 minutes. Most of it was about data. Let's dive into that a little bit and some of the applications that you're seeing now. So,
data is available, and when you layer data, it becomes very, very powerful. So here in Oakville, we have some great data and AI companies. Geotab, probably the largest AI and data company in Canada, is here in Oakville. The company that I work for, Innovex. And we're taking data, and the best way to kind of explain it is to give examples. So if we give examples of Innovex, part of what we do is healthcare. So in healthcare, for 14 years now, for cystic fibrosis, we have been collecting their data. And as you collect data, the more data you have, then you can start to predict. If you can predict, then you move on to preventing. If you can prevent, then you can pivot, because that no longer happens, and you go in a new direction. And the last P is then it's a pace, then everything speeds up. So for cystic fibrosis, after collecting all this data for them, we now have a system where there's been papers written about Innovex that people that have cystic fibrosis in Canada will live at least or about 10 years longer than if they have it in the US, because we take that data and we use it. So we can warn a doctor that his patient is presenting or her patient is presenting this way, and it shows that in 3 months that patient will be in the emergency and will lose some lung capacity, so act now. So this is all preventive measures that you can take. And that's the power of it in the world of medical. And for people like cystic fibrosis, all the patients are involved. We reach out to their cell phones, their mobiles, we ask them questions, surveys, so it becomes people-centric. Cystic fibrosis patients can go onto this website and they can see all the data, all the tests that have been done to them, everything. Things that we hear our medical hospitals and so on cannot do is already happening in areas. So we do cystic fibrosis, osteoporosis, CAMH, 300 clinics across Canada. So this is just one of the powerful things of data.
So you're collecting all that data, and as you said, you're contacting them on their cell phone or their email or whatever it might be. What are the privacy concerns?
So you start with efficacy and you start with privacy. So you have to do this if you're handling OHIP numbers and personals items. You also have to have a really good company that understands how to structure it, because what you don't want is all your data in one place. That is called a honeypot, and that's what hackers love, a honeypot. But if you put the person's names over here, and over there you put their OHIP number, and over there you put your addresses, they actually have to end up hacking 6 different places, figuring out how the 6 different are done, and it's too much effort. So they go for the easy ones, the companies that have honeypots.
there's a lot of big companies that have been hacked.
Every week you'll hear about a new one.
Maybe you need some consulting to do on a couple places.
We would love that business.
Yeah. So let's go back then to cystic fibrosis, because one of the things that strikes me is that if you've been able to do that, you've been doing it over 10 years, why is it that we can't have that in the health system for every record? So for instance, I go to the doctor, they punch up a number and they can see what's happened to me at a hospital or at another clinic or whatever it might be. I'm not trying to dump on politicians here by any means, but to me that would seem the next logical step in every piece of predictive medicine.
In the medical field, it's complicated. I haven't spent my life in medical. I've worked for Google and Tesla and other people along the way. But when I look at this field, and I'm involved in this field now, what you see is a culture of silos. That they have the data, but they don't know how to connect to another one. And they don't understand that connecting to another one makes your data even stronger, because no disease lives by itself. No nutrition lives by itself. So if you can interconnect these things, suddenly so much more can be unlocked. And it's that willingness to unlock it. And there are ones that are going down this path, but I feel that we're not going fast enough. And we do need some policies to ensure that we are on track to go quicker.
The one thing that strikes me is that for somebody that's a patient, a cystic fibrosis patient, that's in a remote location, they somehow now would have more of a benefit from a larger pool of experience, right? I mean, if I'm in Toronto, I probably have how many other cases that maybe that same doctor has seen.
And this is a beautiful point that you bring, because cystic fibrosis wanted to ensure that the good medicine is not in the GTA. Because if you're in rural Ontario or rural anywhere, your medicine is very different than when you're in a GTA where there's research and all this going on. So they wanted to ensure that what was learned here became best practices, and those best practices went out across the country so that the level of care is the same. And if a doctor only has 1 or 2 patients in a certain disease, they really don't have enough data to understand what this is. So they need data and AI to do the heavy lifting so that they can be creative.
I don't want to go too far ahead because there's a lot of case studies we can look at. You touched on in our conversation around the case study with the Vancouver waste collection and their 311 service.
So that's another example of data now in a municipal level. So they had certain goals that they wanted to reach, the city of Vancouver, in being able to collect, save money, be more efficient. And our software and their work together has created a system where it's now mapped out. They all have geotab devices in the truck, which allows the truck to provide all the data that's necessary for us to do our job. So we do things like we break the groups with help of the union. We break the groups into little pods that go to work every day. We plan their routes according to traffic and weather and certain other conditions. And everyone can see how everybody's doing. So if one team is finished before the other ones, they can go help. Not only that, but all the 311 calls are directed right into the vehicles where they have Android tablets, and the truckers, the waste management people can respond right away. And this has done things for the city of Vancouver where they used to have 200 callbacks a day where a truck had to go back and pick up something. They've reduced that to 0. And they've reduced their fuel costs by almost $500,000 every 6 months. And we even worked with the union to model and to show that if we added another shift, the city could actually save money. So this was done, and we added a 3rd shift, and now we're even seeing greater savings to the city. And this is the data that we should be using in Oakville and everywhere to advance what we're doing.
You're watching Conversations, a production of the Oakville Chamber of Commerce, and our guest today is Mark Majewski, a passionate innovator and Senior Vice President at Innovex, located right here in Oakville. Let's talk about Innovex and the partnership or the new initiative with the Government of Ontario.
Yeah, so that was exciting news because, you know, when we saw COVID hit, and Rohit, the CEO, and we kind of just sat down and goes, what can we do to help? And we realized, you know, data was a big part of it. So we approached the Ontario government and said, you know, we know healthcare. We also know logistics from our other side, our relationships with Geotab. Let's put these together and do something correct. We will do this not for profit, we will just do it for cost. But let's show an example where the government can now see how data-driven decisions are made. So with the help of Trillium Network, we're taking all 700 PPE suppliers in Ontario, we're going through them to make sure they're not resellers, who's the manufacturer, we're mapping them, we're mapping all the LTCs, and then what we do with our data is we then model what the LTCs need, and we model what the manufacturers are doing. So now we can see, is there a mismatch? What percentage of PPEs are LTCs buying? Has something gone wrong? Suddenly has an LTC using 3 times as many or half as much? And what happens if there's a hurricane in Houston and stops oil production by 20%? What does that mean to PPE production? We can model all this and give that information in real time.
So explain to me the modeling and who's doing that? You must have, the skill sets that you have must be immense as far as being able to take that data and understand. It's not just modeling it, but understanding it and reporting on that.
And it's also layering up, you stand on people's shoulders.
Yeah.
It's not doing it yourself. But modeling just means in the PPE world, for instance, how many employees do you have? How many shifts do you have? What's your policy in using them? What's your run rates today? From that, you can already create a pretty good model of what they're doing all the time. And we can also go out through something called an API, which is what connects one piece of software to another. And we can connect to their ERP system, what runs the long-term care home. And we can look at their inventories and we can start seeing what's happening. Are they really using as many? Are they not? And helping them. Because truly the magic of really good software is you start at the end and then move to the beginning. And the end is that LTC wants a dashboard where they can look at that dashboard and see what's happening. I have enough, what's the influenza rate around me, how many people have COVID, whatever they want on that dashboard, we will create for them. So they have value for giving us data. We can also create that dashboard for the government. The government may want to see different things. And other people along the chain, like the suppliers, they also want to see data. So we create these dashboards so that there's a two-way communication and everybody gets value from it.
It seems that the application for data is really limitless.
It is.
So, you've touched on the logistics piece, makes perfect sense to me. The health piece makes perfect sense to me. What other industries can we see applications of data where it may benefit?
Wow.
Did I just open up a big box?
There isn't an industry that can't use data, but it's also creating a culture and an ecosystem that works. For instance, Geotab has 2 million trucks running around North America, all here through in Oakville, and these trucks have sensors, so you know everything that's going on in the truck. And those trucks are UPS, Pepsi, all of those trucks out there. So if we tap into that data as a city, say of Oakville, we can make a geofence, so we're only looking at trucks running around Oakville, and we can see if their windshield wipers are on, which means it's raining, which means the city doesn't have to water places or can cancel soccer games without having to build sensors. And this is that data exchange. If we layer data, if you take, for instance, just traffic data, you get so much from it, but not a lot. Now layer weather and season on top of it. Suddenly everything starts making sense. And start layering more data. So if restaurants have data, or logistics companies have data, or hospitals have data, when you start connecting these, that's where things really start to unlock.
Is there a future where the application of data may have helped us be more prepared for the pandemic, for instance, or, as you said at the start of the program, for whatever comes next, and something is going to come next?
There's always something next, and you don't know what it is, but if you can build this community and data, it kind of provides you with a radar. You don't need it until you need it.
Right.
But when a blip shows up, suddenly you can pull up this radar and start seeing where's it coming from, how fast is it coming, and if you have all of those interconnections done, you can react faster instead of, well, how do I get that data? Who has that data? If it's already talking, it really works quite well.
Is it shared?
It should be.
And it's not?
It's not.
Because I know you mentioned Geotab, and Geotab's very good at making data sets available. I keep saying data. Should I say data or data? Anyway, making their data available and public, but that's not the case?
Well, medical data you don't want to make
For
public.
sure.
But there are other sets that should be public. And Geotab makes it available to universities, to companies, to try to learn from them as to how are they using it in unique ways. And from that, they can create business models. So it actually helps them. But if we all share parts of our data, we know when you get into this data what you want to own, what is going to be your intellectual property. But what's not going to be your intellectual property? What do you have to lose to share that with someone so together you can move ahead? So there are parts that need to be shared that are private, so to speak, to Geotab, to healthcare, to Innovex. But there's a lot that should be shared and should be indexed the same way and connected the same way so that quickly people can do things.
Where's Innovex headed next?
Well, in the short term, we still want to stay in our logistics and healthcare area. But what you can quickly start to realize is data really doesn't care about the subject matter. So when you look at a chronic disease, there are many chronic diseases in business. A chronic disease in business is cash flow. Right. It's employee turnover. It's many things. So once you have the systems built, it's just a different data set you're bringing in. You will never solve cash flow in a business, but data can start giving you analytics and things that you've never realized when you're buying things. Maybe if you bought it earlier, it's cheaper. Maybe if you bought it as a group. There's all kinds of stuff that it's not smarter than you, but it does the heavy lifting. It starts to connect things that you've never thought connected, and it brings it to light.
Right. You touched it before when in our pre-conversation around the application of in the building trade and in construction a little bit, not just data, but also just smart building. Can you talk about that a little bit?
So in a smart city, and I hate that word, I like a connected community better because nobody wants to live in a smart data city. They'd rather live in a connected community where I see you, but I get value from other things. So in Data Industry 4.0, which has been around for a long time, you make a digital model of what you're doing. And with a digital model, it gives you things that can amplify. For instance, if you're a construction company and you're building a building, why not use a technology called LiDAR, which very precisely maps the building, each step that you're building it. At the end, you have a model. Now you can give that to the business owner who buys the building, and now they can literally take the wall and peel back the layers, because they can peel back the plaster and see exactly where that wire is, exactly where that pipe is. And to fix it, I need 3 elbows, so I better order those before I cut into the wall. And I better cut into the wall right there because I don't have to cut and look, because nothing's ever built as per the print. So these are the type of things that you can use in manufacturing, in service. If you can create digital models of your system, you can get a lot of value and faster answers. You don't like the term smart city, but I know one of the complaints about smart cities is, again, coming back to privacy and that collection of personal data. And how do we get past that? Because you have two camps, ones that want to push that forward, and then ones who are saying, well, wait a sec, personal information can be tracked, and that's something I'm not comfortable with. Is there a place to get past that argument? I think that's kind of a place where government needs to step up, and there are privacy and efficacy people within the government that can tell you how to do it. But I don't think, personally, this is a personal opinion, someone like Google, whose business model is to sell data, should be holding this data. It should be governments, it should be broken up and everybody has a little piece of it, so there's not one big honeypot. And when there's no big honeypot, it kind of makes it a little bit harder to put all the pictures together. And I think this data needs, again, to be shared, but it needs to be ethical. You need to remove the person's name, their address, just like we do in medical records, so that research can take place, because those things shouldn't be connected, but how that person reacted to a drug or whatever, that should be able to be seen by a researcher. So in smart cities too, we should have set it up at the beginning with security and ethics, so that people, children, my children, your children, that is peeled off. Mm-hmm. Nobody has a right to know who's using this data or sending this data, but what they're doing is really important to infrastructure. Right.
We just have a couple minutes left. Time always goes very quickly.
It does.
We do love our crystal ball on this show. Can you look forward 3-4 years, hopefully with the pandemic well in our rearview mirror? What technological advances should we be seeing, whether it's in the data community or in the technology community, period? And at what point does 5G come into that whole experiment?
Well, 5G is here now. So
it's not everywhere, though.
It's coming.
Yeah.
Before we blink a year or two, it will be almost everywhere. But again, there's all these different technologies. There's blockchain, there Industry 4.0, 5G, AI, machine learning. And when you layer all these things together, just like data, suddenly it becomes very powerful. So where's it going to go? I'd be a billionaire if I knew that, but I think we have to start at least putting down certain rules about privacy and efficacy, but it will be able to predict what we're doing and provide us a better service if we do it correctly. And I think that's kind of the important thing, that all of these technologies need to do the heavy lifting so that we can do the stuff that we like to do, and that's to come up with the ideas, to do different things, because what all these technologies don't know is people. They do heavy lifting. And I'll use a quick example. So that if AI is reading 12 million pages or papers a month in medicine, it has a pretty good idea how to heal somebody. So it can come to a doctor and say, here's 4 different paths that seem to be working today based on the right statistics. But what AI doesn't know is maybe that person's wife just died of cancer and really doesn't want to live, or maybe they've just gone through chemo. That's the personal part. Mm-hmm. That's the part that's going to become more and more important in our society in 5 or 10 years, because the engineering, the accounting jobs, those AI can do pretty well. It's the human relation jobs that I think, and the ideas that are going to become more important. It's going to a little bit be the reverse of today.
Lots to think about.
It is.
Thanks, Mark.
Thank you.
Thanks for being our first in-person guest. That's all the time we have for today. Thank you very much for joining us. We'd love to hear from you. If you have any feedback or if you have ideas for guests on our new season, please let us know by dropping us a line in the comments section or emailing us at info@oakvillechamber.com. Thanks again for tuning in, and have a safe and productive day.